the oncologists. They're specialized in working with cancers. So I let them do what they do best. I let them do what they studied and specialized in. And I stay out of the way. As far as with herbs, I do use acupuncture through the whole process, be it surgery, radiation, chemotherapy, and biologics. So, and you can control most of the symptoms that come along with, the side effects that come along with those therapies. As far as using herbs, I tend to wait until they're completely finished with their chemotherapy, their cancer therapy, and then I'll begin the process of building them back up again. Or if they're taking long breaks in between rounds of chemo, that's when I help build them back up again with like a constitutional formula and some anti-cancer herbs I'll throw in as well.
Certain, supplements that we use that help build patients, build your people's systems and make them stronger. You make your immune system stronger, make your ability to be resilient and recover faster, stronger, improve nerve conduction, improve blood flow. Those things are essential when you have breaks between chemo, right? To try to really get your body as strong as possible, because chemo is a toxic agent. And so, while it's killing off the cancer cells, it's also depleting your system. All right, welcome everybody. We are super thrilled to be here again with another fantastic guest on this holistic health kind of video series where we're highlighting different holistic practitioners and different specific conditions that some of these holistic treatments can be used for. So I'm super thrilled to have with me today David McMahon, who is the newest member of our team and at Holistic Health Associates in Frederick. Welcome, David. Great to have you here.
Thank you for having me. I appreciate it.
Yeah, for sure. So I wanted to have David on because David has a very unique interest within the field of Chinese medicine in that he focuses or has a subspecialty in working with cancer patients. And a lot of people who are going to be watching this video don't realize or may not know that cancer care is a very important subspecialty within the field of Chinese medicine. And so I'm thrilled to have you as a specialist in that, David, and would just love to hear a little bit about kind of your background, how you got interested in this, and then we'll open it up to kind of who would be a good candidate and what are some of the things that Chinese medicine can do within this,
Yes.
field. So tell us a little bit about your background with this.
Well, my background is as a cancer survivor. I'd never experienced acupuncture before. I'd always thought about holistic medicine, try to, take care of myself through diet and exercise and whatnot. So when I was diagnosed, beginning therapy was exhausting and my digestive system was really thrown off. And I had a friend that came over to my home and treated me a couple of times. And my energy came back and my digestion began to become regulated again. And I was able to weather the storm of cancer treatment. And so that was my first introduction to it. And from there, I realized that, what I had experienced, I wanted to bring to other cancer patients. So that's when I decided to study acupuncture.
Yeah. I mean, it's interesting how many people get into a field like this because of their own experience. And,
Yes.
Unfortunately, clearly for to have to go through that but fantastic on the other side of it and, clear and now
For sure.
kind of found a path, for yourself, right?
Yeah. And when I entered acupuncture school, that was my goal to begin with. And so I made sure that I stayed in touch with support groups, made contacts with other support groups. And I lived in Gainesville at the time, North Central Florida. So there was a lot going on there, big hospitals and whatnot, to try to make inroads into some of the folks that have been experiencing it. And just so I could talk to them and let them know that I've been there and that there are options for them to get through the symptoms that come with cancer therapy. So that's kind of where things went. And then I did a little postgraduate training with Memorial Sloan Kettering, as well as some other continuing education courses on cancer. And I really began to hone in on my focus. And from there, I was lucky enough to get on board at UF Health Integrative Medicine with a director that was very sympathetic to cancer patients. So she started bringing in cancer patients for me to treat. And I ended up doing a summer rotation in the infusion center, treating patients while they were going through chemotherapy infusion.
Mm.
And at that moment, I'm like, well, I've arrived. This is what I wanted to do. I'm here. Then I realized, I looked around. I'm like, okay, this is now really what I'm doing, and to help the people in front of me right now going through what they're going through. So, so yeah, that was a pinnacle moment in my career so far, and I'm looking forward to being able to share more of my skills to those that are going through chemotherapy.
Yeah, for sure, for sure. So what was it that you saw as a patient going through that, and some of the people that you were, in treatment with, or in the hospital with? What was it that you saw that you felt like was missing in the care? Clearly chemotherapy saves many lives.
Yeah.
But obviously there's something that you saw within the Chinese medicine, field that became interesting. So what was that? What did you notice about those patients?
Well, I mean, when you go through this mechanism, this machine of modern medical cancer care, it's very sterile. There's not a lot of human contact. It's very, it just has a way of grinding you down. Your days become medical appointments. Your days become commuting if you don't live near a hospital. You're from one visit, from one test, from one scan to another. Suddenly this is your life. Everything's turned upside down, and it's not just your life, it's your family's life too.
Mm-hmm.
So the level of anxiety and stress that overcomes the family or the patient themselves can lead to often, depletion in the immune system. So the cortisol levels go up. And so you're already going into the situation set up to be immunocompromised. And so what I saw was not just to help support the cancer patient's immune system, but to manage the stress that comes along with it. Objectively at the time, I was able to step back and see that this was something of a need in the cancer care. And that's why I decided to move forward with it, because I knew that this is something that a need that I could fulfill. And as far as those that would be more likely to be candidates for it, I say every cancer patient is a candidate for acupuncture.
Mm-hmm. Mm-hmm. Yeah.
Because they all share the same symptoms.
Yeah. Tell us a little bit about that. What are some of the things that you see within the, that if you're watching this and you're, currently going through chemo, I'm sure you're very aware of, but for those people that may not be doing that and are just interested, or maybe have a family member, what are some of the primary symptoms that you see that, that this brings about that we can help with?
Well, I think fatigue is one of the primary ones. Stress and anxiety, fear. Also, just the basic, symptomatology is nausea, vomiting, depleted immune system. It's neutropenia would be the biomedical term for it. Neuropathies, digestive issues, hot flashes, night sweats, all very common depending on the kind of cancer and the kind of chemotherapeutic agents that are being used.
Right. Yeah. Yep. For sure. Yep. And so, so what do we do? Give people a little insight into what would happen if they're already going to chemo, they're either going, multiple times per week, or they're going for, a week straight, and then they're taking a little break. How do we work in, acupuncture and potentially some herbal medicinal and really help that person with those side effects and those symptoms, and work it into their particular chemo schedule, if you will?
Right. Well, the way I like to practice is I like to allow, if we're talking about specialization, the oncologists, they're specialized in working with cancers. So I let them do what they do best. I let them do what they studied and specialized in, and I stay out of the way. As far as with herbs, I do use acupuncture through the whole process. Be it surgery, radiation, chemotherapy, even biologics. So, and you can control most of the symptoms that come along with, or the side effects that come along with those therapies. As far as using herbs, I tend to wait until they're completely finished with their chemotherapy, their cancer therapy, and then I'll begin the process of building them back up again. Or if they're taking long breaks in between rounds of chemo, that's when I help build them back up again with like a constitutional formula and some anti-cancer herbs I'll throw in as well.
Mm-hmm. Yeah, fantastic. So what David's referring to is there's certain, supplements that we use that help build patients, build your people's systems and make them stronger. You make your immune system stronger, make your ability to be resilient and recover faster, stronger, improve nerve conduction, improve blood flow. Those things are essential when you have breaks between chemo, right? To try to really get your body as strong as possible, because chemo is a toxic agent. And so, while it's killing off the cancer cells, it's also depleting your system. So the more you can build yourself up in between, the more valuable it is. And clearly at the end, right, David?
Absolutely. Yeah, you get into the convalescent phase. So you want to make sure the digestion is working well, absorbing all the nutrients it can. They're feeling better. They're able to get out and function better. I mean, these are the ones with a good prognosis, even if they're going through the concerns about recurrence, like a cancer may likely recur. Acupuncture and herbs can be very effective in controlling some of the fear that comes along with that.
Right, fantastic. So acupuncture throughout the whole process can have a huge benefit. Herbs, we're very cautious and we're very, thoughtful about when and how we administer those to really be most effective and to not take away from any of the treatment that you might be going through. Fantastic. What about radiation? Any tips on how does the process change when you're treating somebody that's going through radiation?
Not really. I think my experience with radiation therapy was exhausting because it's actually not just. And let me back up for a second, because this was nearly 20 years ago. And cancer treatments have come a long way. With radiation therapy, they're able to target just the cancer cell or the tumor and spare the cells around it, the healthy cells. So I think it's called the gamma knife. They're able to really get in there and pinpoint it. So when I went through, it was really more of an overall area that they were irradiating. So I experienced much more fatigue than someone would experience today. But fatigue is often a part of radiation therapy, and it's cumulative. It doesn't just happen right away. It can take, because you're in there for 5 weeks at least. So about 2 or 3 weeks in, you start to feel it. So about that time is when I brought acupuncture on board. And I think that's something that patients may experience. We don't know these days, but may experience that. And so basically, it's really something that you would do throughout therapy, regardless if it's radiation or chemotherapy.
Yeah, gotcha. Fantastic. And then how about the experience for the patient? So if you're someone who is currently going through chemo or has been diagnosed with a cancer and you're planning to go through chemo, what should they expect if they combine, holistic medicine, acupuncture specifically with that process? What will they experience if they come to our office? They might be concerned about how it makes them feel while they're getting it. Give us kind of like your step, baby steps around what the patient will experience when they come to you.
Well, it's what's interesting with each cancer and each form of therapy, the symptomatology is different. Like someone could be experiencing extreme fatigue, someone could be experiencing nausea and vomiting, yet their energy is fine. So when you come in, it's really a matter of identifying what symptoms are causing the most burden. What can we do to alleviate them in order for you to function in a way that you would like to? Be it, exercising or spending time with friends and family, working. A lot of people have to stay working these days while they're going through chemotherapy. So just a matter of making sure you can function, managing those symptoms, and keeping you healthy. Because we don't want to sacrifice the organism to cure the disease. We want to make sure that we support the organism in order so it can come up and help fight the disease.
Yeah, fantastic. So it's a two-ended approach. You have the the overall support of the system, and then you have the targeted approach based on the symptoms that the patient may be experiencing.
Correct.
Yeah, beautiful, beautiful. With what about some of the logistics? So does insurance can insurance cover acupuncture for patients that might be going through chemotherapy?
Well, in Maryland, I'm sure it could.
Yeah,
Your insurance, because coming from Florida, the insurance providers there wasn't a lot of support for acupuncture, but I know Maryland has that,
yeah,
and I know that so definitely more insurance providers provide acupuncture coverage, and so I think that wouldn't be, regardless of what you're getting the services for. I think cancer would certainly be one that would be covered if you have
right.
acupuncture coverage.
It's one of the real benefits of being in the Maryland area is that
Hmm.
we do have very good coverage for
Hmm.
acupuncture as a state, and it's
Hmm.
something that, depending on the side effects and the symptoms that the patient may be experiencing, that sometimes dictates whether we will have coverage or not. And so in our
Right.
office, we tend to combine. We have some patients that are
Hmm.
using their insurance and seeing what that might be able to help with, as far as what the treatment plan is and how much insurance can help, take some of the cost out of that
Hmm.
process. And then we have some patients that are self-pay, and we do a
Hmm.
discounted rate for those patients. But insurance does cover a lot of for sure, some of the pain management, for
Yep.
sure, neuropathy, which is tingling and pain in the extremities that often comes as a result of chemotherapy. And so there are a number of different headaches. There are a number of different
Yep.
symptoms that are covered, and so we are able to check that for you as a patient, and then we will make sure that you know exactly what to expect as you and what your responsibility will be as you come into the office.
Which is wonderful, because if you think about who really needs that type of care, um, you know, cancer patients are at the top of the list.
Yeah, yeah, yeah.
This is not just a simple muscle strain.
Mhm.
This is a life or death situation.
Yeah.
And in order to have and to get the kind of care that you need going through that process to build you up in order to weather the storm of cancer therapy, the season of cancer therapy
Mhm.
is it's very important.
Yeah, beautiful, beautiful. Yeah, and so for those of you that may not have ever experienced acupuncture, one of the real benefits is not only is it targeted at some of the things you have going on, but it's also very relaxing. It's very good for your stress. It's very good for just relaxation in general. It seems hard to believe because we're going to be sticking needles in you and you're going to be laying on a
Yeah.
table,
Mhm.
but it is incredibly relaxing. And you will have a call bell or a buzzer at our office if you're a new patient. And that way, if there's anything that you get nervous about or uncomfortable with, if we're stepping out of the room once the points are in for a few minutes, you'll be able to reach out to us. And so the process is extremely joyful for most people, because it's helping you, because it's helping
Yeah.
to bring back some of the energy, bring back,
Mhm.
reduce some of the headaches, et cetera, and some of those symptoms that you might have. So just
Yeah.
want to make sure everyone knew kind of what that might look like if they
Yeah, and everybody I think is familiar with serotonin and dopamine, and these are some of the neurotransmitters that are released with acupuncture, and
Mhm.
that's one of the reasons it's really great at treating stress and anxiety.
Yeah. Yeah, for sure. Definitely, definitely. What else? Anything else that you think is important to know about, how about, is there support for this? Sometimes there are patients that are asking us, will their doctor support it? And, as
Mhm.
an adjunct therapy for when they're going through chemo. What's your experience with that?
That's a good question. From my experience, most physicians are fine with acupuncture.
Mhm.
Most oncologists are like, we actually have it in our hospital, and that's what's really interesting is acupuncture has become much more prominent in modern medical cancer care. There are hospitals all over the country that use it, specifically in cancer centers, because acupuncture can do something that nothing else can do.
Mhm.
They have no answers for some of the neuropathy other than neurotonin or some type of medication. So and that's the one thing it can do. And I guess to your point, so physicians have an understanding for that,
Mhm.
and they'll often encourage it if you ask. sometimes you have to bring it up. They're not necessarily going to say, I think you should get acupuncture. It's something you have to bring it up to them to say, hey, this is what I'm thinking about doing. And they're most likely going to endorse it. Some of them maybe write a prescription for it, which is really something. Yeah. Herbs, on the other hand, it's not really something that oncologists understand, or nor do they want to involve when the patient's going through, especially chemotherapy.
Mm-hmm. Yeah.
But acupuncture, not a problem.
Yeah, fantastic. Very good. Anything else you think the people out there that might be watching this should know, or any words of encouragement, any thoughts for those people?
Well, as I mentioned, a cancer diagnosis is, upsetting. And you may have seen friends or family members go through the process, and that registers with you. Like, I do not want to look that way after chemo. I don't want to be emaciated. I don't want to have all those symptoms. But it is a season, and it's meant to pass. So embracing what you need to do, as many people do, really raises your chances of getting through it. It heightens the probability and the likelihood that you'll survive and not suffer some of the side effects that others do. So it is a season, and just move through it with grace, and make sure you look into holistic therapies like acupuncture to help manage some of the side effects you'll feel.
Yeah, fantastic. Just beautiful words and really, really good advice. And we are very lucky to have you as part of our team. Thank you for doing what you do. And David has not only been through this, he has treated it. He's treated it in a hospital. He's been a supervisor at a student clinic at a graduate school. He is a wealth of experience and information in this area, and so we hope that you will take advantage of that service and what it can help you with as you go through that process. So thanks for being here, David. This was fantastic.
Thank you. I appreciate it.
Yeah. All right. Take care, everybody. We'll see y'all soon.